I was turning 30. I had just been married a little over a year and a half, and I had a daughter in diapers. So to get that diagnosis, it shook up my entire world. I mean, a young woman, obviously I'm in my career, I was an admissions counselor at the time, and we were planning to purchase a home, so we were, house shopping, and to get that diagnosis, it really stopped my world. And I had to reconfigure life as it was at that moment, how to get through the journey of breast cancer, how to keep my life on a path that, after I get through the journey, I can pick up the pieces. And of course, financial is part of it too. So finances going through breast cancer is another whole big issue. Unfortunately, the size of the tumor was, I believe, 6 centimeters from what I remember, what I recall. And there was some signs of tumors, calcifications that had left the tumor site. So there was already some sprinkling through the breast. So the immediate recommendation was to remove the breast, and then from there treat it aggressively. So I had adriamycin cytosine, which is ACT, aka the red devil. And it really was that. It knocked me on my back. Oftentimes people talk about how, I worked through treatment and, that was my saving grace. And in breast cancer, the breast cancer journey for everyone is different. For me, I was not able to work. I would go in for my treatments on Thursday, and by Thursday afternoon, I was definitely laid on my back, and I would not get up until that following Wednesday. Signs of feeling as if I had flu-like symptoms and neuropathy in my hands and feet, and cold-like symptoms. It was horrible. Mouth sores and achiness, and just the inability to take care of my daughter, to take care of my house. It was aggressive. And I mean, although it was aggressive for a time, obviously I'm here 10 years later, so it worked. I tried to have reconstruction immediately following the mastectomy. They put in what they call an expander, a tissue expander, so that they can expand the space between the muscle and the skin to then insert an implant, and it failed. They tried. Unfortunately, the area became infected. And quite honestly, I just felt like my body had had enough. I went through several surgeries. The first surgery was the mastectomy, but then also I had a lymph node dissection to determine if there was any lymph node involvement. The breast cancer, the cancer had spread throughout my body. So they tested my sentinel lymph node and found that there was a trace of cancer, and so they went in and removed, I think, 13 additional lymph nodes, and out of that they had one that was cancerous, and so my body had had enough. It just couldn't take it, so it wasn't healing. So they aspirated the area where I had the infection. We thought that would take care of it. It didn't. And so the infection came back. And so finally I had to make a decision. Do I want to keep going through this process of trying to reconstruct a breast right now, or do I want my body to heal? And I chose for my body to heal. I chose to be living and healthy and whole. 30 years old, someone who believed in bikinis and trying to live one-breasted. And like I told you, I only had my breast. I was a pretty thin woman. I've always been about 125 pounds. Now I'm a little heavier, but then you could tell that it was something different about me. So here I am, every day trying to fill in that space, by putting my prosthesis in. There were times where I would wear a low-cut shirt because I'm young and that's all I've had was cleavage, and then my prosthesis would fall out. Because I didn't want to wear my prosthetic bra at that moment. I didn't think it was beautiful enough. So I went through all kinds of things, and I lived like that for 7 years, and it wasn't easy. It was hard. It was, every day I look in the mirror, and it was a reminder of what I had gone through. And being that young and having that much change in your body, it was emotional. I mean, I'm emotional now just thinking back on it. But there came a point, and it was on a vacation with my husband, where I was determined to wear this pink bikini. I was determined. And we were kind of vacationing, like a late anniversary vacation. And my husband was looking at me fuss with this prosthesis. And finally, I said, I'm going to take it out. And I'm just going to wear my bikini. And obviously, one side was larger than the other. I've always been a C cup or so. And so I turned to my husband and I said, how do I look? And he said, you look beautiful. And I said, okay, I'm going to the pool like this. And I said, if anyone asks me why I look lopsided, I'm going to tell them the truth. And I'm going to tell them what I've gone through. And that was the start of me being comfortable with my new normal. I decided to attend this conference for young women. It is put on by the Young Survival Coalition and Living Beyond Breast Cancer. And I went to this conference, and it was really me identifying with younger women and their journey in breast cancer. And when I went, all the topics were relative to everything that I had put on the shelf. So they talked about fertility. And here I thought I couldn't have any more children. I could. You know, there were some steps that I needed to take that I hadn't even taken because I put it on the shelf. The other thing was reconstruction. They talked about reconstruction. And the first thing I thought about was, people go get breast implants and enlargements all the time. Here I am, I'm missing one. Why not go and get a second one? I got a reason. So I told myself, if I go and this time there's no infection and, the expander is fine and I'm able to complete the process, wonderful. If I go, I have more infections, I have other challenges, I won't do it again. And so that really was kind of my deciding factor. It was just the things that I had put on the shelf. I chose to take them off the shelf and deal with me. I'm content with what I have. Are they perfect? No. Do I have a nipple? No. I had a tattoo that didn't take. I had a nipple that didn't take. It's like you have to decide, what are you comfortable with? How far do you want to go on this journey? How near perfect are you trying to be? And my near perfect is, am I healthy? Am I happy? And do I feel whole? And I do. When you hear the words, you have cancer, take a moment to breathe. Everything is going to happen so quickly to you. You're going to be thrown so many suggestions and recommendations and urgent needs because we got to deal with this urgently. But take a moment just to breathe and reflect on the type of quality of life you want after you complete the journey. So you're almost looking to the future immediately versus looking in the present situation. Because when you dwell in it, it can be so overwhelming. To hear you have cancer and to hear you're going to go through X amount of rounds of chemotherapy, aggressive drugs, and X amount of rounds of radiation, and they're going to have to do various surgical procedures on you. Breathe. You'll get through it. It's just a matter of how do you want to get through it. At the end, what is the end result? You just want to be happy? Do you want to be healthy? Do you want the cancer gone? Do you want to look in the mirror and say, I'm still Katrina, regardless of one breast or two, I'm still here. I'm still here for my daughter, and I still have a loving husband. And as far as relationships are concerned, I would say, talk. Do whatever you can to communicate what you're feeling. Because if you don't, that is really, that's the cancer to the relationship, if you're not talking about your emotions.